Which of the following is the most likely cause of this patient's GI symptoms? So 35-year-old woman, family history of MIN1, recurrent episodes of peptic ulcer disease, diarrhea, and abdominal pain, reveals elevated serum gastrin. Abdominal CT shows multiple pancreatic neuroendocrine tumors. Which of the following is the most likely cause of this patient's GI symptoms? Okay, so she's having peptic ulcer disease, diarrhea, and abdominal pain. Um, that almost sounds like, oh, elevated serum gastrin. Is this like a gastronoma?
Okay.
Would that, or would it be like yeah, I think I'm gonna go with hypergastronemia.
Yeah. So do you know what so that's good, right? Sometimes keeping it simple is going to be really easy, right? Do you know what how do I say this? What disease by name that can cause, that follows in the MEN type 1, right? But causes you high gastrin levels with peptic ulcers and things like that, right? Do you know what syndrome it's called?
Um, I'm blanking. I'm sorry. No,
No, no, no, that's okay. That's okay. I just wanted to have you think about it a little bit. But yeah, so you said gastronoma, right? And so Zollinger-Ellison syndrome, if you remember that.
okay. Yeah.
Yeah, so that's going to be like a gastronoma, right? You secrete a bunch of gastrin, right? And then Zollinger-Ellison syndrome, right? Which is associated with MEN1s because you have pancreatic tumors, right? You can have pituitary, right? And that's going to be kind of your MEN type 1, right? And so let's kind of go through your MENs real quick since we're on here, right? So what is included in MEN 1, right? So MEN1, right? Usually endocrine glands that involve parathyroids, right? So hyperparathyroidism, right? Pancreatic tumor like gastrinomas, things like that, and then pituitary glands, right? So pituitary adenomas, right? And then the next thing, right? And remember, what is an MEN2A, right? And so it's always good to review these. Medullary thyroid carcinoma, pheochromocytoma, parathyroid hyperplasia, right? So the way I remember it is type 1 has P, P, and P, right? And then type 2A drops a P and becomes an M, right? So medullary and then pheo and then parathyroid. And MEN2B, right, is going to have all M's pretty much. 2B. So a bunch of right M's, right? So and one P is usually what I say, but medullary, pheo, mucosa neuromas, and also marfanoid like stature. So very long, right? Skinny, tall people. So just kind of things to remember. Okay, questions about that?
No, sir.